4,400 young individuals are waiting for support from the Child and Adolescent Mental Health Service, CAMHS. We're faced with a really stark reminder of the urgency and the immense responsibility that we have as a government in addressing youth mental health issues across Ireland, because this number isn't just a statistic. It represents real lives in need of immediate attention and the urgent need for reform and for better resourcing across our youth mental health services. We all know someone directly or indirectly affected by this in our local town, in our local village. I see it all the time in my constituency, in places like Clondalkin, Lucan, Rathcoole, Newcastle, Saggart, Bridis and City West, where parents are struggling to gain access to timely assessments and to treatments for their children and teenagers who are experiencing mental health issues. And this in turn is causing a significant amount of undue stress and worry on the children themselves, on their parents and on their wider family. CAMHS, a service that's purpose is to serve as a place of comfort and support for our young people in need, unfortunately now finds itself at a crossroads. While the dedication of the staff working tirelessly within CAMHS is absolutely undeniable, the reality we face is one of overstretched resources and ever-growing needs in society. The narrative has become one of frustration amongst parents and families who can't, despite calling for action, can't access timely care for their child or teenager. And the knock-on effect is spiralling. The recent independent report by the Mental Health Commission on CAMHS has identified key areas of concern, and they include things like inadequate clinical governance, insufficient risk management, and a lack of proper oversight and staffing. And all of this contributes to a compromised level of care that CAMHS can offer. Echoing these concerns, the advocacy group Families for Reform of CAMHS, who represent over 960 families, have provided extensive testimonials, and they've given voice to the systemic failures that they've experienced within the CAMHS service. Families for Reform of CAMHS have captured really the barriers, the anxiety and the fear faced by parents. And parents, they're telling us, are afraid to say their child has autism in case of repercussions. 85% of families have encountered negative repercussions upon disclosing their child's condition. Some families have been informally advised against disclosing an autism diagnosis to avoid being excluded from receiving care in 2024. That's a serious disconnect in our health service, where the very act of seeking help can lead to the exclusion from essential services. And that's wrong, and I know, Minister, you're doing so much to change that. Studies published in the Journal of Social Psychiatry and Psychiatric Epidemiology highlight the importance of early mental health interventions. And on top of this, research by the Irish Journal of Medical Science sheds light on another pressing issue: the well-being of our psychiatrists and our mental health professionals themselves. They want to help. They want to do a good job for these children. That's what they've trained to do. That's what they've chosen their career to do. But their inability to do so, their overstretched resources, is causing retention issues and motivation issues within the system. And Minister, I think at this point, if our mental health system was a patient, we'd have well diagnosed it with burnout by now. I welcome the strides being made under your leadership, Minister Butler, the establishment of the National Office for Child and Youth Mental Health, and the commitment that you and your team has put in place to the No Wrong Door policy. They're monumental steps towards ensuring that every young person receives the care they need without unnecessary obstacles or delay. This year, Government allocated substantial funding towards enhancing our mental health services, an additional €10 million secured in January, specifically aimed towards new developments in youth mental health. CAMHS itself receives €137 million in dedicated funding annually, with an additional €108 million in funding provided to community-based mental health organisations and NGOs. This investment is the cornerstone of the Government's broader commitment, illustrated by the €1.3 billion allocated to mental health budget since the inception of this government. And that marks a significant increase, and it reflects the high priority this government places on mental health. This commitment is underpinned by the collaborative efforts of healthcare professionals and NGOs like Jigsaw and like Pieta, and the invaluable insights of families who navigate these challenges daily. As we move forward, this needs to remain top of government's agenda, and I know, Minister, you're doing all you can to make sure it stays there. Because timely access to mental health service is not a luxury. It's a lifeline. It's a lifeline that can change the trajectory of a young person's life, and that's what we need to always remember. Thank you.